because we're stuck in, and I'm going to do this, and therefore I expect this outcome. And we do that with, I've always, in my time tutoring and supervising postgraduates in the clinic, I've always said to the students that your outcome is never right or wrong. Now, it would be right or wrong if we look at it from a randomized controlled trial or experiential.
Based on your hypothesis.
Yeah, absolutely.
It fits or doesn't,
But you have an outcome you didn't expect. Now, why is that? And I talk about the butterfly effect, and they talked about, a butterfly's wings creates a tornado on the other side of the world type thing. And I don't think we do that. But I take your point. You would expect, if I'm going to do this to a patient or do this to in a clinical setting, you would expect a change within 24 hours. That there's something going to change.
I always have this conversation with patients, and they often laugh at me because I say to them, the worst result is that you're exactly the same.
Yes.
I don't care if you're much better or you're much worse.
Yeah.
But if you're the same, I'm pissed off because it's like what I did nothing, or it hasn't created any appreciable change. So if they come in, and they always get really annoyed with me and they say, "Oh, I was really, really sore, and it made my symptoms worse." Oh, great. And they're like, "Why are you saying that's great?" And I said, "Well, because we've got more information now. I understand the actual mechanical loading or whatever I've put in place has had an effect. It might have been the magnitude might have been too high, or the duration too long, or volume, or whatever it is. But I've actually got more information now, and that's helpful to me."
But you know what that highlights to me straight away too? It's similar to what we were talking about before of this ultra-conservative approach that a lot of clinicians take, because, if you do have an exacerbation of symptoms, sure, it's not always ideal and context is everything, but more often than not, the process of getting better is not going to be this gradual improvement over time.
But I think the big thing with that is communication.
Absolutely.
Explaining to the patient and taking them through the likely scenario of what it looks like, or even, I think I'm getting better at this slowly, which, I'm a slow learner, but asking them to actually maybe even outline how they envisage it's going to play out. Because I think the thing that I've seen as being probably the most beneficial to my practice when we started talking more about evidence-based medicine and looking at what the model actually proposed was actually respecting the patient values and expectations.
Yeah.
And asking that question of like, what do you expect out of this physiotherapy input? Or, what are you hoping to get out of this? Or what do you value? And I've had this conversation with people multiple times where you could clinically get the exact same outcome. We've spoken about I've written a blog, I remember, about like, say, knee surgery, post meniscus injury or something like that. If one person, they have the exact same outcome in terms of range of motion, the pain level, all of those things, but one of those patients really wanted to run and the surgeon said to them beforehand nothing about whether they could or couldn't, and then they can't run, that person's really pissed off with their outcome compared to the person who just wanted to walk. And they're ecstatic that they can now walk without this catching pain in their knee. The outcomes are exactly the same. And if you haven't asked that question about, okay, what do you expect out of this intervention, you're not going to get an idea of what that actually means for the patient. I think that's sort of been really important for me.
And one thing that I've learned over my time, and I'm probably a bit of a slow learner too, is that people are not dumb.
Oh, no.
And so
we disrespect people, I think, a lot when it comes to this.
And
this stuff.
Sit down and explain to them. And I've had long conversations about cell biology and biology and muscles and things like that. And what I've found is I've actually had a positive change in that a lot of my clients will go and read and come back to you with a whole lot of stuff saying, "I've read this, what do you think?" And they're looking at this. And I think that's something that as physios we've got to realize, and I certainly realize as an academic tutor as well, is that I'm not the source of all knowledge. The internet's got more knowledge than I can, but I've got to teach my client to become discerning, because gone are the days where you probably remember, as seen on TV, as if it was the gospel truth, if it was appeared on television. But people are saying, as the science says, so you've got to teach your client how to read that science and say, well, hang on, if you look at this doesn't fit what you've got because of these reasons. What I've found is that the client actually has I would say favourable, it's probably not the word I'm looking for, but a mind shift. and they actually start to participate in the
they're
management.
part of that process,
And
and that's so much more powerful. I
Isn't
think.
it? Yes, and these people that come in and they're engaged, they come back to you and say, "Look, when I went home and I was really sore from what you did, but I found that I was able to lie this way and the pain went away." And you think, "Oh, that's great. I'll do that."
Yeah.
That's important.